State health officials say there is new evidence that monkeypox is spreading here in Texas. Previous cases were in patients who had traveled internationally, but some new cases are in patients who have not traveled. Fox 4's Blake Hansen spoke with a top state health official today and joins us tonight. Blake.
Yeah, Heather, this is a virus that does not spread very easily, but state health officials are working to make sure that they can treat cases as they arise. Public health officials in Texas say with the rise in monkeypox cases worldwide, it is no surprise to see it is now spreading here.
Though at first, a lot of our cases did seem to be linked to international travel. Some of our more recent cases aren't.
Dr. Jennifer Shuford is the chief state epidemiologist with the Department of State Health Services. The agency says of 12 cases identified, 3 of those cases were people who have not recently traveled, evidence of community spread. So far, officials have been able to identify where the transmission came from, with the virus spreading between people who have had close contact.
There has not been any recognized transmission happening to healthcare providers that might be taking care of these patients, and there hasn't been any known transmission on airplanes during this outbreak either. And so that just more evidence that this isn't being spread super easily the way that COVID-19 was.
State health officials haven't said where in the state community spread is happening, but some of the monkeypox cases have been in North Texas. The CDC has identified nearly 400 cases in the U.S. California has the most at 89, followed by New York and Illinois. Doctors say it can begin with flu-like symptoms, followed by the patient developing a rash that looks like pimples or blisters.
A lot of the people who are getting monkeypox are men who have sex with men, who identify as gay or bisexual. However, we know that this virus can spread between any people who are in close contact with each other if one of them has monkeypox.
The state says it is able to get vaccines for local health departments via the Strategic National Stockpile. Doctors say getting a vaccine within 4 days of exposure can protect a person from getting sick.
We don't have large stockpiles of that in Texas, but we have been able to access it very easily and have been told that we should be able to access it very easily in coming months as well.
Doctors say they are not seeing very many people having to be hospitalized with this strain of the virus, but they're working on educating people on the symptoms so that people know to report it to a doctor. That way they can get better treatment, but it also helps with tracking the spread.